Come in.
Hi, Miss Haynes. How are you?
Good.
My name is Megan Marshall, and I'm a student nurse from Prairie View A&M. And today I'll be performing a few assessments on you today. So I'll be performing a respiratory assessment, a cardiovascular and peripheral vascular assessment, and an abdominal assessment today.
Okay.
So first I'm going to start by performing hand hygiene. And I'm just going to ask you a few questions if that's okay.
Okay.
So first I'm going to start off by asking you, have you had any trouble breathing lately?
No.
What about a persistent cough?
No.
Any high blood pressure?
No.
What about any chest pain?
No.
Any tightness in your chest?
No.
Any abdominal pain?
Nope.
Any nausea or vomiting lately?
Nope.
Okay, good. So first, I'm gonna start off by with the respiratory assessment, and I'm just gonna start by inspecting the shape and the configuration of your thorax. And I'm noticing that I'm noticing that your spine is straight and it's aligned, and it's the scapulae are symmetrical, and your scapulae are symmetrical, and your ribs slope appropriately. So now I'm just gonna inspect the skin. Do you mind if I lift your shirt up?
No.
Okay, so I'm just gonna take a look at the skin, and I'm noticing that the skin is consistent. The color of the skin is consistent with ethnicity, and there's no pallor, and there's no lesions, and there's no bruising. So, which is good. So now I'm going to inspect the vertebrae, and I want you to just hold your neck down. Okay. Any pain or tenderness while I palpate here?
No.
Okay, and I'm identifying your C7, and I'm just gonna walk my fingers down your spine to see if it's straight in line. And there's no pain or can you lift up for me?
No.
There's no pain or tenderness here. Okay, so no pain or tenderness noted. So now I'm gonna palpate your chest expansion, and I just want you to take a deep breath. Okay, so chest expansion is symmetrical, which is good. So now I'm gonna be palpating your posterior thorax for any pain or tenderness. And wherever I palpate, I want you to just tell me if you feel any pain or any unpleasant tenderness, okay? Anywhere you feel my hand, just let me know. Any pain or tenderness there?
No.
Okay, so no pain or tenderness is noted, which is good, and no masses or lumps noted as well, so that's good. So now I'm going to palpate again, and this will be for tactile phlebitis, and just let me know once again if you feel any, I'm going to palpate again in the same spots and just breathe normally. Okay, so the tactile phlebitis is prominent symmetrically, and so now I'm gonna percuss. I'm gonna percuss in different areas of your lung fields and just breathe regularly. Okay. Okay, so your lung fields are resonant upon palpation, which is good and it's normal. Okay, so now I want you to, so now I'm going to start auscultating for your breath sounds, and just give me one second. Now I'll be auscultating for your breath sounds, and I'm just going to be looking for any abnormal sounds. just breathe normal for me, okay? Okay, so your vesicular breath sounds were clear over your lung fields and there were no adventitious sounds heard. Okay, so I'm just gonna start by inspecting your anterior thorax, and I'm noticing that the thorax is symmetrical and there's no redness. I'm just gonna open your shirt if that's okay. So I'm not noticing, I see a scar possibly from is that from a past surgery? Okay. And there's no redness or other lesions present, which is good. Okay, so now I'm gonna inspect your ribs and stuff, and you can just stay normal for me. Okay, so your ribs slope down at a 90-degree angle, which is good. And now I'll be looking at, can you hold your arm straight out for me? So your transverse diameter has a 1:2 ratio, which is good as well. And now I'm gonna take a look at your respirations and your rate of breathing. So can I have your pulse? Let me do this one. Your respirations was about 18 breaths per minute, which is normal. And your breathing was automatic and it was effortless. It was regular, which is all expected. So now I'm gonna, there was also no use of accessory muscles, which is good as well. And so now I'm gonna palpate the anterior chest wall for any pain or tenderness and let me know if you experience anything, okay? Okay. Any pain or tenderness here? What about here? 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 What about here? And here? Okay. So there was no tenderness or pain or any masses noted, which is good. So now I'm gonna start percussing, which is the same thing I did in the back, and I'm just doing it in the front. Okay, so your lung fields are resonant, which is good. And now I'm gonna also take your breath sounds and identify any adventitious sounds. Okay, so your vesicular breath sounds were clear over your lung fields and there was no abnormal sounds heard, so that's good. Okay. So now I'm going to be performing the cardiovascular assessment, and I'm just going to start by inspecting your neck for pulsations, and I want you to just turn your chin to the left. And then turn your head to the right. Okay. So internal jugular, your jugular pulsations were present, and usually you would be in a supine position, but since we're not able to do that, this position should work fine. So now I'm gonna auscultate your carotid pulse, and I want you to just turn your head to the left for me. So I want you to, so inhale, exhale, and hold it, okay? Okay. Do this, turn this way, turn your chin that way. Perfect. Okay. So the carotid pulse, there was no carotid bruit present bilaterally, which is good. And now I'm gonna palpate your carotid pulses. Okay. Okay. So your carotid pulse was, your carotid artery was 2+ bilaterally, which is good. And now I'm just gonna inspect your precordium and look for any lifts or heaves. Okay. So there were no lifts, heaves, or visible pulsations present. The color of your skin is consistent with your ethnicity, which is good. And I also noticed that there were no lesions or any cyanosis. There was no cyanosis present. So now I'm going to palpate your apical impulse, and I want you to just inhale, exhale, and hold it. Okay? So go ahead and inhale, exhale, and hold it.